Pharmacies will now be able to administer the Pfizer COVID-19 vaccine, but only those registered on government system will receive the jab. Government is aiming to open more sites to fast-track the rollout. Over 170,000 vaccines have been administered under phase 2 of the rollout so far. Well, eNCA's Heidi Giokos is following developments there, seeing what's happening this morning. Heidi, a very good morning to you. So I'm sure lots of people probably hoping that this process is going to be made much simpler, that it's going to be streamlined now, with places like Dis-Chem joining the come and get your jab sort of fray.
Yes, Yuveka, I'm actually really struggling to hear you. I'm not sure if it's a signal issue, but most certainly it's crucial for the private sector to be roped into this mass vaccine rollout that government has undertook as of Monday, last week Monday, where phase 2 kicked off. So we do know that pharmacies have been roped in to assist with this mass rollout. And we are at Dis-Chem's head office here in Midrand, Johannesburg, where we are joined by the National Clinic Manager, Lizette Kruger. Thanks so much for your time. This seems to be quite an operation here. Speak to us about when you started, how things have been unfolding here for phase 2 of the mass vaccine rollout.
Thank you, Heidi. We've been operational from last week Monday, and it was almost like a test run due to the fact that we are going to open mass vaccination sites with a capacity between 500 and 700 per day. And it was a good learning to understand the whole process, you know, with the administration on the EVDS, because it's crucial. They have to be loaded on the EVDS. You have to verify that they're over 60 and they already registered on the EVDS, and then to get them through the dispensing system and obviously to the vaccinators and keep them 15 minutes to see that there's any reaction. So it was quite an operation. So we did last week, we did about 3,800 in totality after 5 days. Shame. Some of the old people were standing here from 4 o'clock in the morning, and please, it's not necessary. So what we did, this facility, we work on a number system. It's just a bit different than the other mass vaccination sites because it's in our DC, and we take 1 to 500 over 60s only and with medical aid. So that's how this facility works. We are rolling out 5 mass vaccination sites today, and that's in Centurion Mall, Four Ways, Mall of the South, Jabulani and East Rand Mall. They must be registered on EVDS, and they must have a booking with a voucher. We are working on a system to manage the walk-ins better, so that they don't stand in a queue for 3 hours, the old people, and when they get to the door, we can't help them. So we are going to manage that like in a Dis-Chem way.
Okay, just quickly tell us though if you do accept walk-ins, because I do know that other public facilities do accept walk-ins, but I know private facilities are opting to rather have those who have vouchers to come in. Speak to us about that aspect. Do you accept walk-ins here?
So for today, unfortunately we won't, because our system is not up and running to manage the walk-ins. So we are working on the scheduling. They must have a voucher from EVDS, and then hopefully by at least Thursday, we will have a system up and running to facilitate walking, so people know that they have a slot if they're going to stand in the queue and they're all registered on either on the voucher system or they're registered on a Dis-Chem facility and they're over 60, that they will be managed and accepted.
Speak to us about the capacity at each vaccination site, especially here at this head office. How much can this vaccination site actually handle? How many vaccines can you administer per day?
Yeah. So it depends on how many vaccinators we've got and also the administrators, because that's also crucial. So we work with a 12 vaccinator site, we work around about on 700 capacity, and a 6 to 8 we work on 500 per day vaccinating facility.
Will you be looking to increase your vaccination sites? I know you've said a couple are opening up today. Will you be increasing that?
We are opening it in Coastal next week, 2 in Cape Town, 1 in East London and 2 in KwaZulu-Natal. Then we are going to open 1 in Free State, and then we will evaluate and analyze the volumes, and if need we can ramp it up to 32. But we first going to just open the 11, or well, this plus this one is 12, and see, how it goes, what's the volumes, and then we can make a decision to roll out more mass vaccination sites.
And then just lastly, Lizette, just speak to us about the stock with regards to the vaccine. Do you tell national government, Department of Health, how many vaccines you need, or do they tell you, okay, today we can only give you 500 vaccines? How does that system work?
So there is a PO system, a purchase order system in place, and we have to allocate what is our capacity per site per day. So the first allocation will be worked out on the capacity, and then after that, replenishment. So they will see that you used 2,000 and they will replenish the 2,000 dosages. So that's how it works.
Okay, and sorry, just last question. The 70 Rand figure that people are expected to pay or medical aids need to take over, can you just explain that to us? Because many people are a little bit confused if they need to get to a discount vaccination site and they need to pay 70 Rand. How does that process unfold?
Okay, so they're not going to pay the 70 Rand. It's not a cash transaction at all. So the medical aids opt in and they will cover for their medical aid members. Unfortunately, the state patients at this stage, we can actually not manage them at a private facility, and it's not just this scheme, in a private facility. It's not been established if the state will cover the state patients at a private facility, but if they go to a state facility, they won't pay anything. So it's not a transaction of money, any cash or anything. Medical aid patients will be covered. State will cover state patients at state facilities.
Okay, but if a patient comes here and is not on medical aid, how does that process unfold?
Unfortunately, due to the risk, and we're not making money. It's really, there's a lot of consumables that we have to use. We have to get nurses to get and to register and to vaccinate the patients. And unfortunately, at this stage, we won't be able to assist if they don't have medical aid. If they're over 80 years, then we will be able to assist. We made that choice with DRH, and they confirmed that. But unfortunately, between the 60 and 80, we won't be able to assist them if they don't have medical aid.
Okay, great. Thanks so much for that clarity. We really appreciate it. So I think that's quite a crucial point, Veka, with many people quite confused around the 70 Rand fee. Medical aid, of course, will cover that, but if they are not over 80, it's going to be quite difficult for this private vaccination site, Dis-Chem pharmacy vaccination site, to take on that cost. And I think there's a bigger issue here and a bigger story to this, is that the Department of Health needs to possibly facilitate that admin cost for these pharmacies to take those patients that actually want to get the vaccine here at this private facility and they do not have medical aid.
All right, we'll watch the situation of the next couple of days, Heidi, for sure, and just determine how this eases the pressure or how this process actually works out for those who do have access to medical aid. Thanks very much, Heidi Giokos, there, just chatting to Dis-Chem about how it's managing this process. Well, this